Although pregnancy and childbirth can be one of the best things to happen to a woman, for many it can also lead to unwanted mental health conditions. On top of the stress of caring for a newborn, recently more and more women are developing postpartum anxiety. In this video, we will be taking a look at what this is, how it can be identified, and how it can be treated.
Postpartum anxiety tends to make you feel like you or your baby are in constant danger. The symptoms you experience is your body's way of reacting to this constant sense of fear or worry. The symptoms of postpartum anxiety can be broken down into 3 categories: physical, emotional, and behavioral symptoms. Physical symptoms include interrupted sleep, increased heart rate, nausea or stomach aches, and a loss of appetite. Emotional symptoms include an inability to relax, forgetfulness, and irritability. Behavioral symptoms include avoiding certain activities, people, or places, and being overly cautious about situations that are not dangerous.
Postpartum anxiety may be more common than you think. In fact, studies reveal it impacts 11 to 21% of mothers who give birth. In Canada alone, 23% of mothers who recently gave birth reported feelings consistent with either postpartum depression or an anxiety disorder.
Some of you may have heard of postpartum depression, or PPD, and may be wondering what is the difference between postpartum anxiety, or PPA, and PPD. Well, first, let's go over some of the symptoms of PPD. Those who suffer from PPD may experience low mood, changes in eating habits, a withdrawal from family and friends, insomnia or too much sleep, a lack of interest in their baby, and thoughts of self-harm or harming their baby, along with other symptoms. Some of these symptoms are similar to those of PPA. However, the major differences are that PPA involves more worrying and an overwhelming fear regarding their baby compared to the excessive sadness or lack of interest that comes with PPD. This panic and anxiety is not commonly seen in those with PPD. Those with PPA have trouble leaving their baby alone or with others due to excessive fear. However, with PPD, others may be spending more time with the baby compared to the mother due to her lack of interest in her child. Both symptoms for PPA and PPD must last 2 weeks or longer in order to be diagnosed. PPD and PPA can sometimes be comorbid, meaning they occur simultaneously. This, paired along with the fact that they share many symptoms, can sometimes make it difficult for individuals to know what they are dealing with. It is best to talk to a doctor and get help from them in order to create a treatment plan. Treatment for PPD involves psychotherapy such as cognitive behavioral therapy or interpersonal therapy, antidepressants, or other medications. This is similar to the treatments available for PPA, which will be discussed in more detail next.
So what can be done if you suspect you have postpartum anxiety? Well, in mild cases, one of the most effective things you can do is educate yourself on this issue to reduce stigma and increase your compassion and understanding around the topic. Also, one of the most effective treatments for any type of anxiety is a type of therapy called cognitive behavioral therapy, or CBT, where the focus is on developing coping mechanisms, setting goals, and managing discomfort. Finally, relaxation and mindfulness therapy can be implemented. This can be either taking some time every day to intentionally relax, meditate, or so forth. For more serious cases, professionals recommend either CBT, medication, or ideally a combination of both. The most commonly prescribed medication for postpartum anxiety is SSRIs or SNRIs, or benzodiazepines for short-term use. Lastly, some further resources you could use are BetterHelp, which virtually connects you to therapists, Mama Care Health, which provides care and support services for parents during pregnancy and postpartum, ADAA, or the Anxiety and Depression Association of America, and in extreme cases, you can call 911. That's all for our video today. Thank you for watching.